Today we're going to examine one group of sedatives that produce their effect by their action on the adrenergic system. Sedatives related to xylazine cause sedation by decreasing adrenergic activity, including the reticular activating system, the area that maintains wakefulness. However, they produce this effect by stimulating alpha-2 adrenergic receptors that feed back and inhibit adrenergic activity, rather than by blocking alpha-1 adrenergic receptors as the phenothiazine compounds like acetylpromazine do. So xylazine is similar to acepromazine, a commonly used sedative, in that both bind to alpha adrenergic receptors and both inhibit adrenergic activity to induce sedation. Both compounds also potentiate the anesthetic effect of other compounds, which makes them useful as pre-anesthetic compounds prior to surgery. But xylazine is very different than acepromazine in other ways. Xylazine has a relatively fast onset of action and a much shorter duration of action. Xylazine also provides more skeletal muscle relaxation than phenothiazines. In addition, xylazine has analgesic activity that's useful in many situations. In distinct contrast to acepromazine, xylazine is also emetic, that is, it induces vomiting, whereas acepromazine is anti-emetic. In addition to xylazine, the compounds that fall into this category primarily include ditomidine, medetomidine, and romifidine. You'll note that these top four compounds are large, like the phenothiazine type tranquilizers, but more flexible in the middle ring, a characteristic that makes them act as agonists. They're sedative by their ability to activate rather than block alpha-2 adrenergic receptors. If the effects of xylazine type compounds becomes excessive, as in an overdose, or if the side effects are a concern, there are antagonists that can be used to prevent the interaction of these compounds with alpha-2 adrenergic receptors, as shown here on the bottom row. In addition to yohimbine, the original but non-selective antagonist, there is xylazine and atipamezole that are selective antagonists at the alpha-2 receptor. Yohimbine is no longer used due to its lack of selectivity. Xylazine is most useful in ruminants, while atipamezole can be used in all species. So how is it that an adrenergic agonist like xylazine and an adrenergic antagonist like acepromazine can each produce sedation? Adrenergic nerves release norepinephrine, which can stimulate alpha and beta receptors located on postsynaptic nerve surface. But norepinephrine also stimulates receptors that are located presynaptically on the nerve from which the norepinephrine originated. While stimulation of alpha-1 receptors on smooth muscles cause vasoconstriction, and stimulation of beta-1 receptors on the heart causes an increased heart rate, stimulation of alpha-2 receptors presynaptically actually signals the nerve to decrease the release of more norepinephrine into the cleft, preventing additional norepinephrine activity. There are two subtypes of alpha-2 receptors. Non-ruminants generally have alpha-2A receptors, while ruminants have alpha-2D receptors. This difference in receptor subtypes accounts for their use in different species. So depending on the selectivity of the drug, the alpha-2 adrenergic agonists are used to induce sedation, the newest being dexmedetomidine, while the antagonists used to block the actions of the agonists. The most universally applicable antagonist is atipamezole. These compounds cause sedation and even some hypnosis at higher doses by decreasing the activity of the reticular activating system, a part of the brain that initiates movement. Xylazine type compounds also cause skeletal muscle relaxation by a central rather than a peripheral mechanism of action. That is, it does not act like curare, a paralyzing compound that acts at the neuromuscular junction. Instead, it acts primarily centrally. They cause analgesia, or antinociception, that's relatively potent, somewhere between that of aspirin and morphine. It's more efficacious in the body, head, and neck, and less so in the extremities. It should be noted that the sedation tends to outlast the analgesia, so the clinical consequence of this is that painful manipulations should be completed long prior to the termination of the drug's sedative effect. Finally, xylazine stimulates the GI tract when it's first injected. At that time, it's circulating at a higher concentration and is less selective for alpha-2 sites. As a result, it stimulates alpha-1 receptors in the GI tract, causing defecation, urination, and emesis. While this effect is not very effective in dogs, it's quite effective even at very low doses in cats. So it's commonly used in cats for the purpose of emptying the GI tract, for example, prior to an unanticipated surgery. Cats respond poorly to apomorphine, which is a compound used to induce emesis in dogs, so xylazine is a good feline alternative. There's an increased urine output, or diuresis, in response to xylazine. This is likely due to an increased renal blood flow and inhibition of ADH. After injecting an alpha-2 agonist IV, its concentration in the circulation is so high that it acts non-selectively to activate all alpha receptors. The stimulation of alpha-1 receptors causes increases in sympathetic tone, resulting in an increase in total peripheral resistance, transiently increasing blood pressure. This is clinically important in cases of head trauma or internal bleeding, as the increase in blood pressure might increase bleeding, hypovolemia, and even cause death. When the drug is distributed and the blood level decreases, the effect of xylazine is just the opposite. It interacts more selectively with the alpha-2 receptors and inhibits adrenergic activity. In the heart, there's a protracted decrease in heart rate, which leads to a decrease in cardiac output, which in turn decreases blood pressure, especially the systolic blood pressure. In the vasculature, there's inhibition of the tonic sympathetic tone that normally maintains a certain level of vasoconstriction. As a result, there's a decrease in total peripheral resistance that leads to a decrease in blood pressure, especially in diastolic blood pressure. So the more persistent effect of xylazine-related compounds on blood pressure is hypotension. Heart block may be caused by a reflex vagal tone following the initial increase in blood pressure, but atropine is not usually found to be useful at that point. Especially in cattle, some animals develop hyperglycemia after injection of xylazine. So it's recommended that xylazine be used largely in healthy animals. Now that we know the effects of xylazine produces, how is it delivered and what happens to it in the body? Xylazines are weak organic bases, so they're marketed as HCl, hydrochloric acid salts, to get them into solution. They're rapidly absorbed and distributed widely throughout the body. Because of their rapid onset and short duration of action, they're usually administered sub-Q, IM, or IV. The sedative effect is terminated by metabolism of the drug in the liver. One notable caution regarding species is that ruminants are not only more likely to develop hyperglycemia, they're generally more sensitive to all aspects of these compounds. The dose to use in ruminants is only about 1/10 that of other large animals. Xylazines are good pre-anesthetic compounds in the cat, horse, and cattle because they provide some analgesic activity, but these effects are very short-acting. pigs are relatively insensitive to the sedative effect of xylazine. Xylazine is also commonly used in large doses prior to the injection of compounds like ketamine or morphine, drugs that have an underlying excitatory component that needs to be antagonized in many species. When given together, xylazines increase the duration of anesthetic action of ketamine in particular, but even barbiturates as well. They decrease the dose of ketamine that's required for anesthesia and decrease the recovery time. They also smooth the induction and recovery from the anesthetic episode. So xylazines can be used for chemical restraint, providing sedation and analgesia for diagnostic and orthopedic manipulations, or to calm fractious animals. They also can be used with local anesthetics for minor surgery, suturing lacerations and so forth in small animals, or for standing surgery in large animals. They're used in wildlife capture for tagging and weighing and so forth. And they're also useful in emergencies to induce emesis, especially in cats, even at doses that don't cause sedation. What are the adverse reactions of xylazine compounds? Although it's advised to use xylazines in healthy animals, there's always the possibility of inducing seizures by an inadvertent intra-arterial injection or too rapid an intravenous injection, even in a healthy population. In cattle, rumen stasis, or atony, may persist for hours, causing bloat and regurgitation. The transient increase in blood pressure immediately following an injection of xylazine is another limitation of their use. It should especially be avoided in patients with known arrhythmias, which can be exacerbated. It's interesting that respiration is not consistently depressed at sedative doses, but a transient and intermittent apnea can be seen off and on after its injection in some animals. So this needs to be monitored. Xylazine can be used during parturition. However, prior to that, it may precipitate an abortive effect. Finally, hyperglycemia may occur due to the alpha-2 receptors' inhibition of insulin release being mimicked by these drugs. In the absence of adequate insulin, blood sugar is increased. So which drugs do you use? Xylazine itself is commonly used in large animals, but not small animals because of its relatively high alpha-1 to alpha-2 ratio. To minimize the side effects of xylazine derivatives in dogs and cats, you'll want to select the more recently developed compounds that have a higher selectivity for alpha-2 receptors, such as medetomidine or dexmedetomidine. These are probably the most widely used xylazine derivatives on the market for small animals. Although medetomidine is good for small animals, the side effects of dexmedetomidine are less. Most importantly, dexmedetomidine causes less respiratory depression and is reversed faster and more completely by atipamezole, the antagonist. In summary, xylazines are useful sedatives in healthy patients in need of short-term sedation and some analgesic activity. But they should be avoided in patients with head injuries, in patients with possible internal bleeding, and in patients with a history of arrhythmias. You should also be careful when using xylazine, as humans are very sensitive to their effects, making these drugs more dangerous for you than for animal patients. So take care to avoid needle sticks.